I'm Dr. Patrick O'Shaughnessy. Thank you for joining us for today's episode of CHS Presents Health Connect. Catholic Health Services is an integrated healthcare delivery system with some of the region's finest health and human services agencies. CHS includes 6 hospitals, 3 skilled nursing facilities, a regional home nursing service, hospice, and a multi-service community-based agency for persons with special needs. Under the sponsorship of the Diocese of Rockville Center, CHS serves hundreds of thousands of Long Islanders each year, providing care that extends from the beginning of life to helping people live their final years in comfort, grace, and dignity. CHS is focused on quality, and through this show and many community health initiatives, we promote good health and provide you access to the care that you may need. I'd also like to thank and recognize each of CHS's 22,000 employees and affiliated medical staff members for their ongoing commitment to quality and service excellence, which is evident at each and every patient encounter. You all are the face of CHS, and we thank you for all you do for our patients and residents every day. When it comes to the care for the tiniest of patients, people turn to experts. Sometimes surgery is necessary, and when that happens, an experienced pediatric surgeon who is able to provide comprehensive surgical care for our children is critical. To speak more about pediatric surgery is Dr. Vincy S. Jones. Please stay tuned to today's episode of CHS Presents Health Connect.
Hey, Hard, what's this?
That's my resignation letter.
You're resigning.
Why? Because you're constantly ignoring me. You're half as active as you used to be, and you get stuff like this. You've been putting me under a lot of pressure lately. That's why I'm ready to quit.
I forgot. I'll do better. Please, don't quit on me.
Okay, but remember, it's not what you say, it's what you do.
Listen to your heart. Don't let it quit on you.
Let's go for a walk.
Uncontrolled high blood pressure could lead to a stroke, heart attack, or death. Get yours to a healthy range before it's too late.
Here's something we bet you didn't know. Nearly half of all cancers can be prevented. That's right, half. Nearly 50%, mostly by making small everyday changes in your diet and controlling your weight, walking more, eating less, and eating foods that help you and your family to seriously reduce the risk of cancer. And of course, by not smoking. Visit the Cancer Prevention Together We Can website and get a free 30-day planner filled with tips, recipes, stats, and more about protecting your family. Go to prevent50.org.
Being a foster grandparent has definitely given me a purpose in life.
I love Grandma Lydia. My favorite thing about Grandma Kara is doing a lot of fun activities.
Just been so happy, just so much more energy than being at home alone doing nothing but watching TV. It's the best part of my life.
I'm a better student because of her. She helps me with reading sometimes.
I am so proud of the work that I do here.
Best part of being a foster grandparent volunteer, watching the light up in the kids' eyes.
Couldn't be more satisfying.
It makes a difference that you get involved with young people.
Being a foster grandparent has been a wonderful, wonderful experience for me, and I'm not going to give it up.
I'm living again, and the foster grandparent did that for me.
Thank you, Grandma. Thank you, Grandma Carol. Thanks, Grandma Jen, for helping me.
Wherever you are right now, right this moment, you've never been closer to saving a child. Every minute, malaria claims another life. But donating just $1 provides a life-saving test and treatment for one child in Africa. $1 given, one child saved. That's the power of one. Save a life now at po1.org.
They'll test you. Try to break your will. But however loud the loudness gets, however many cheese puffs may fly, you're the driver, the one in control. Stand firm. Just wait. And move only when you hear the click that says they're buckled in for the drive. Never give up till they buckle up.
Welcome back to CHS Presents Health Connect. Joining us now to speak about pediatric surgery is Dr. Vincy S. Jones, Chief of Pediatric Surgery, Pediatric Trauma, Medical Director at Good Samaritan Hospital Medical Center. Thanks for being with us today, Dr. Jones.
Thank you.
It's great to have you here. Now, you know, as a doctor, I can rationalize some of what you do, but as a parent, my goodness, a very stressful potential time if, God forbid, your child needs surgery, but even more important than if they do, that they see someone like yourself, an expert, a pediatric surgeon. So tell our viewers at home a little bit about some of the uniqueness of pediatric surgery and being a pediatric surgeon.
A pediatric surgeon is someone who is trained as a surgeon to take care of children and who is trained to operate upon them and look after them. And so why do we need a pediatric surgeon? It's because children have unique needs.
Yes.
Their diseases are very specific. And even for sometimes simple, common conditions like a hernia or an appendicitis, which you see in adults and in children, you find that the treatment varies. And so that's why you need a pediatric surgeon.
And there's a whole degree of specialized training that goes into this. You don't just decide to operate on children. Maybe share a little bit about the level of training that you've received to do this.
That's true. So, you know, after our medical school, we end up going through a prolonged surgical residency.
Yes.
And then we do go through fellowship. And I've personally gone through 3 fellowships. And so I was getting pretty old by the time I decided to hang up my training boots and get started with actually taking care of children.
Yes, so again, subspecialty trained. And, you know, that training comes about at academic medical centers. And, you know, you go through, this is where you train and whatnot. And obviously you were part of academia and working in that environment. Why did you choose to leave a major academic institution and choose to join Catholic Health Services?
Yeah, I think when I look at my previous tenure at the Children's Hospital of Pittsburgh, which is one of the top 10 children's hospitals in the country, and compare it with what I do now, I would say that while at academic centers you're at the forefront of investigative medicine, at community hospitals like Good Sam, you're at the forefront of personalized medicine.
Yes.
You get the opportunity to participate in that whole journey the family undertakes as their child goes through a diagnosis, through surgery, and through recovery. And the other thing that comes to mind is the CHS family has helped me to get an opportunity to be a child advocate.
Yes.
You know, most of us who take up children's surgery, or for that matter, most child specialists are child advocates at heart. And I think for the CHS to have that mission is pretty natural because it is an extension of Jesus' ministry in the Gospels, where you see Christ welcoming children at a time when very few were inclined to do so.
Yes, it is vitally important, and I'm so glad that you mentioned that because, you know, we're truly blessed to have someone like you on our faculty. You not only possess the brain and tactile skills to be such an excellent surgeon, but you have the heart, you have the passion, and that shows with families. I know personally, I get many letters about the care that you receive, that you deliver, and that the patients receive, and it's very, very impressive. What is, from your perspective, what's the most challenging part of pediatric surgery? Is it neonatal surgery? I mean, I can't even imagine this beautiful, precious little neonate, newborn, needing surgery, and so delicate, yet so complex. Can you share a little bit about what that's like?
Yeah, you're right, Dr. O. Neonatal surgery is indeed the most difficult component of pediatric surgery, and I think it's primarily because of the size and their unique physiologic needs.
Yes.
And so some of the premature babies that we operate upon are as small as 1.5 to 2 pounds.
Oh my goodness.
And so it can be pretty challenging to actually do surgery on those babies. And then when these babies undergo surgery, we have to be conscious of their needs, like temperature stabilization, infection control. A lot of their systems haven't matured, so we have to be conscious of all these various aspects when we operate on babies that small.
Yeah, so very complex, not just the actual technical part of the surgery, but the physiology.
That's true.
And helping them get through that. So very challenging indeed. How do you manage to obtain such excellent surgical outcomes in newborns requiring surgery? I mean, your outcomes are phenomenal, and the care at Good Samaritan has been phenomenal under your leadership. How have you achieved it?
I would say technique and teamwork.
Yeah.
You know, on one hand, you know, you have to have the dexterity to operate on small babies. But, you know, I really appreciate the baby specialist team that we have at Good Sam. And we have been able to assemble a very good team, a team of neonatologists who are able to take care of these babies in an intensive care setting. We have excellent pediatric anesthesiologists, again, specially trained to give anesthesia to babies. We have nurses, physician assistants, all trained to handle babies. And so I think that's a very, very important aspect of this all.
So I love what you said. It's skills and technique, but also teamwork. And we certainly at Good Samaritan have a really comprehensive, well-trained team to help support you to deliver those outcomes of care.
No doubt.
So really incredible. Let me ask you another question. This is somewhat of a sensitive topic, but what if a congenital malformation is suspected during pregnancy or prenatal scans? Can the expected mother meet up with you for a consult? How would you go about helping them get through that situation and deliver the best care for that child?
Yeah, I mean, talk of, aggravating your shock, you know. So when you tell a mother that you need to go and meet a pediatric surgeon, but surprisingly that works out in a very nice way, because I think that's the best thing a mother can do if, she's given the news that her child has a possible malformation. So the pediatric surgeon who knows about that condition can sometimes give them a good news that the condition gets better. They can also give them a real nice outlook of what is about to happen as a pregnancy progresses, as a baby comes to delivery, and after delivery, what takes place. And I have seen time and again mothers visit me and go back with a lot of reassurance that their baby is going to be okay at the end of the day.
Yes, and in your field, in your specialty, the techniques, the tools, the diagnostic aids are advancing so rapidly. I mean, now we're even doing in utero surgery and actually changing the outcome before that child is even born. That's incredibly impressive for what you do. When we return, we'll continue to discuss pediatric surgery at Good Samaritan Hospital Medical Center. Please stay tuned to CHS Presents Health Connect.
This is the story of a boy who didn't talk for a long time. The boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. So he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day I found out I have something called autism. My family got me help. Slowly, I found my voice and learned all the ways I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
I never wanted to be associated with heart disease. I never wanted to be the poster child for heart disease. I never wanted people to know that there was something wrong with me.
Going through recovery from open heart surgery or being affected by heart disease can be incredibly isolating.
It's not easy on your body, on a woman's body.
I felt really alone because no one my age really had this problem, never had this issue.
And just knowing that there's a circle of women who know exactly the struggles I face every day and are there for me is so empowering.
I realized that I wasn't alone, and no matter your age or race, I made friends and found sisterhood and really found a second family that made me feel that I wasn't alone anymore.
There's so many ways that you can get involved. You can join the movement, you can volunteer, you can be an advocate, and you can donate. All you have to do is go to goredforwomen.org.
Grandpa, look what I got. Let me see.
Oh, Dad, wait till you see the bike we got for Jake.
Hearing loss happens gradually with age, making it easy to ignore. Yet most older Americans aren't getting their hearing tested. Untreated hearing loss can keep your loved ones from enjoying what they cherish most.
Dad, can you hear me?
Don't let that happen. Speak up about hearing loss. You'll be glad you did.
You can't text and pay attention to the world around you, and you definitely can't text and drive. Every year, deaths due to distracted and negligent driving are increasing. In fact, while drunk driving rates have dropped greatly, negligent driving fatalities have skyrocketed. Find out more at negligentdriving.com.
Welcome back to CHS Presents Health Connect. We are joined by Dr. Vincy S. Jones, Chief of Pediatric Surgery, Pediatric Trauma Medical Director at Good Samaritan Hospital Medical Center, to continue to talk about pediatric surgery. Welcome back, Dr. Jones.
Thank you.
So let's talk and share a little bit more with the viewers about the actual techniques used to operate on our children, which are really, at Good Samaritan under your leadership, minimally invasive, laparoscopic-based procedures, and even robotic procedures. Can you share a little bit about what you do in those fields?
Yeah, a substantial number of pediatric patients are eligible for minimally invasive surgical techniques. And I'm happy to say that we have a very comprehensive pediatric minimally invasive program at Good Samaritan Hospital. Why do I say it's comprehensive? Because we cover all ages, beginning from 1 month all the way up to the age of around 18 years.
Wow,
and
so
then
full spectrum.
That's right. And then we offer minimally invasive surgery in different modalities. There is laparoscopy, which is basically minimally invasive surgery for the belly. We have thoracoscopy, which is minimally invasive surgery for the chest. We have single incision surgery, which is doing minimally invasive surgery through a single cut.
So one single tiny cut.
One single cut on the belly button. And we also have robotic surgery. And it is indeed encouraging to say that we are only one of 2 centers in the entire state of New York which provides pediatric robotic surgery from a general pediatric surgical standpoint.
Now let's talk about robotic surgery, because I want our viewers at home to be able to understand that the robot offers the surgeon an additional view, clarity, and technique, but it's really about the hands of the surgeon and their comfort level with doing this. And you have done, how many procedures robotically have you done in your career?
The robotic surgery procedures, we are approaching close to 100.
Wow.
At Good Samaritan
At Good Sam alone.
At Good Sam alone. And it is something that we need to understand that from a pediatric standpoint, a lot of the patients are not eligible for the robot because the robot is pretty huge.
Yes.
And so that's why across the country, many centers, including the biggest children's hospitals, they have struggled with developing a pediatric robotic program.
Sure.
And I think CHS has been really supportive of the pediatric robotic program. I personally applaud your leadership and initiative with that program as well.
Wanted to support you.
I think what that does is it helps the community to have access to the very best, especially the children. And we use a robot in a stingy manner. We are compassionate to the robot as well.
Absolutely.
Absolutely. And so while very few centers are able to actually have a robotic surgical program, getting to 100 cases is actually pretty impressive.
It is pretty impressive. And yet you're doing so much work, as you talked about, single site incision, laparoscopy, again, minimally invasive surgery using the laparoscopes you've described before. What's the advantage for a child? I mean, I can know from an adult, and you can see the difference in recovery patterns and from a minimally invasive approach. But for our viewers at home, share the benefits of minimally invasive laparoscopic surgery.
Yep, it is the advantages are pretty much the same for children and for adults. The old adage, big surgeons make big incisions, that's no longer true. So the current era is one of smaller incisions, and that's what people want. And especially children, as they grow up, as they get into the teenage years, they just love the smaller scars. And then from a physiologic standpoint, they just recover quicker. And we can also get to some of the difficult areas in the body and get good visual when we do minimally invasive surgery.
Right. So all in all, benefits for you as a surgeon and benefits for the patients that you care for.
Yeah, for those particular conditions where there is an indication. And in this regard, I would also like to mention about the single incision robotic surgery that we do for children with gallstones.
So let's talk about that.
Yeah.
So that's really innovative. That's something unique that you offer. Tell us a little bit about that program.
In fact, the single incision robotic surgery done through a single incision in the belly button which enables a surgeon to take a gallbladder out full of stones just through one incision,
Amazing.
leaving behind no scars, practically no scars,
Right.
which are visible.
Right.
Now, that is, to my mind, the preferred approach both for patients and for the doctor to remove a gallbladder in children. And so we are able to offer that for children, and I'm happy to say that Good Sam has been the pioneer in this particular operation, and we were the first to report this in the entire world.
You're kidding.
Yes, that's true. And
Wonderful
so,
news. Right here in West Islip on Long Island, under
That's-
your leadership.
That's right. So 3 years ago, we reported it in our premier journal, the Journal of Pediatric Surgery, the first series in the entire world. And so I think that is pretty impressive. And I can tell you that we are approaching now around 60 patients or so. They're all extremely happy with it.
Wow.
And they often get to compare their scars with the scars of their parents
Of
and
course.
others who've had surgery as
Big
well.
difference, right?
Big difference. They are
Big difference. Before we close, let me just ask, anything else that you would want to share with parents in the communities in which we serve regarding the specialty services that you provide, making them aware of what's really available right in their backyard, again, under your leadership?
Yeah, I think, if your child has a problem, I would say, come and meet up with a pediatric surgeon. If your child needs a surgical intervention, it can be done safely. It can be done in an efficient manner. It can be done in a very smooth fashion. And babies and children, they tend to have excellent outcomes when it's done the right way.
Yes.
The margin of error is small,
Yes.
but if it's done right, children just recover much more quickly than adults.
Yeah, I think that's incredibly well said. And I want to thank you for your leadership in helping build out this program at Good Samaritan and everything you described for pediatric, minimally invasive, and robotic surgery. And we're looking forward to helping grow the program across Long Island. I want to thank you as well for being with us today on our show.
My pleasure.
Thank you, Dr. Jones. We'll be right back for my final thoughts and my health tips and solutions of the day. Please stay tuned. My final thoughts on our discussion today. Children are one of the great gifts of life. As a father and a physician, I will tell you it is vitally important that you seek the proper care for your child. So that involves normal preventive care, getting in to see your pediatrician and doing the appropriate tests. But then, if God forbid something does occur and is wrong, seeking out the appropriate care in the appropriate setting with an appropriately trained provider, such as Dr. Jones that you saw earlier on the show regarding pediatric surgery. Today, we will be discussing the dangers of undiagnosed high blood pressure, which occurs when the force of your blood pushing against the walls of your blood vessels is consistently too high. A condition that affects approximately 30% of the adult population. Elevated blood pressure can cause hypertension, putting a person at risk for heart attack, stroke, and congestive heart failure. As with all of my tips, I'd like to offer one great source of truth, and this one is from the U.S. Services Preventive Task Force at www.uspreventiveservicestaskforce.org. On their site, if you search for high blood pressure screening in adults, you will find a detailed outline of their screening recommendations. To function, the body's tissues and organs need the oxygenated blood. Each heartbeat pumps blood throughout the body's circulatory system, creating blood pressure. This pressure is comprised of a systolic blood pressure, where blood pressure from the heart is pushed into the arteries through the circulatory system, and then diastolic blood pressure when the heart rests between beats. If either of these forces are not functioning properly, then steps must be taken. But how do you know if you have high blood pressure? What are the signs and symptoms? High blood pressure or hypertension is dubbed the silent killer for a reason. Many times there are no signs, no symptoms. Normal is defined as a systolic, that's the upper number, of less than 120, with a diastolic or bottom number of less than 80. High blood pressure stage 1 is 140 to 159 systolic and 90 to 99 diastolic. a hypertensive crisis requiring immediate emergency care is higher than 180 systolic and higher than 110 diastolic. This is yet another reason it is critically important that an annual physical be conducted. Only a healthcare professional can diagnose this potentially deadly disease. With high blood pressure serving as a primary or contributing cause of death for more than 362,000 Americans, the USPSTF recommends screening for hypertension in adults 18 years of age and older. The screening has little harm and offers numerous benefits. Expanding upon the guidance, the USPSTF further examined the diagnostic and measurement accuracy of various blood pressure monitoring, along with methods used to confirm hypertension. Their conclusion? Screening and treatment of high blood pressure in adults reduces the incidences of cardiovascular events, causing few major harms, and the net benefit of screening is substantial. You can find more information about the USPSTF screening guidelines at www.uspreventiveservicestaskforce.org. That's my tip for today. For more health information, watch CHS Presents Health Connect, airing on Telecare and CBS TV 55. To view recent episodes, go to CHS's YouTube channel. If you would like to know more about pediatric surgery, please visit chsli.org. From there, you can click through to the websites of each of our healthcare partners for more information on ways to give. We are always grateful for the community's support because your gift today helps shape the healthcare of tomorrow. Thank you for watching today. If you have any medically related questions you would like for me to answer on future shows, please email us at healthconnect@chsli.org. Please include your name and a way to contact you in case we need to reach you. I'm Dr. Patrick O'Shaughnessy, and I hope to see you next time on CHS Presents Health Connect.